All right, joining me now to break down what the pill is and what it means in the fight against COVID. Joining us now is Dr. Andrew Campbell. He's the director of the University of California, San Francisco Surgical Critical Care Fellowship. Dr. Campbell, thank you so much for joining us, sir. So how does this COVID pill work?
Well, thank you for having me. I really appreciate it. This is some really great news. So for a long time, we've been struggling with trying to figure out how we can treat people better who actually have the disease for COVID. So Pfizer has a new pill. This pill is actually given in addition to another antiretroviral or a treatment for HIV. And it was given within 3 to 5 days, it can reduce the incidence of hospitalization and death. One group was given the pill, another group was given a placebo, and the incidence of protection in terms of hospitalization went down about 89%. So it is actually a really good news. This joins Merck because Merck also has a drug that can do the same thing. So we're very happy about that. But I have to say that the best treatment is for you to get vaccinated. And I think we have to get back to that. So this is another tool in our armamentarium, and we're very happy to get that now.
Well, speaking of getting vaccinated, tell our viewers what the difference is. What's the difference between an antiviral treatment, the vaccine, and now this pill? Tell us about that.
So first thing is that the best thing you could do to protect yourself against the virus is to get vaccinated. Vaccination means that you get the shot and your body then is programmed for when you get exposed to the virus, it will respond naturally so that it turns things on when the virus comes on, so it protects you. Now, these new drugs, actually, you get the infection, and once you get the infection, then they have to recognize it within 3 to 5 days and they have to treat you. So one is a treatment regimen for the infection once you have it, and a vaccine is you take it so that you don't have to get the infection and you don't have to worry about any of that stuff.
All right, Dr. Campbell, for some folks that say, hey, I was already infected with COVID, right? I don't need to get vaccinated. I got the antibodies. In layman's terms, sir, can you just explain why it is important to get vaccinated and how the body actually responds in the event it comes in contact with someone who's infected?
So that's a good question, and that's created some confusion, particularly with some of the things that you hear on media and online. So the first thing is that a vaccine will protect you better than immunity that you acquire from the infection. So whenever you get an infection, there's a certain amount of immunity that goes along with it. But what happens is when you get the vaccine, the response is much more robust. So if you have a choice between getting the infection and all the issues that go along with it, because there's not just getting the infection and surviving it that is difficult, but it's also long COVID. I mean, they think that about 20 or 25% of people will get long COVID syndrome. So you don't want to get the infection and get immunity that way. Everybody's like, well, some people will say, well, I got the infection. Like, you got the infection, but the infection does not protect you nearly as much as the vaccine. The vaccine is way better. And we've got new studies that really show that vaccination is the best way to protect yourself against this serious worldwide pandemic.
All right, Dr. Campbell, thank you for breaking that down for us. All right, so back to this pill. Is it similar to Tamiflu, which treats the flu?
It is kind of similar, but it's a little bit different. It's much more complex and it works a little bit different, but it is a treatment. So the treatment we have for COVID includes things like remdesivir, which is an IV administration of a medication after you get the infection, and steroids have been shown to help. But now this and the Merck pill, so the Pfizer and the Merck pill, the Pfizer pill given in conjunction with a second pill, and the Merck pill given standalone are now working its way through approval. They are not approved and they are not available, but it is encouraging that we have this information. It'll present it to the FDA and it'll go to the CDC and they'll make recommendations. But right now, these two pills by Merck and by Pfizer, which is the new one, which everyone's excited about, that came out on Friday, that one is not available for the general public yet.
All right, Dr. Campbell, we got about 30 seconds, if not less. Who would you recommend this pill to?
So I would recommend this pill to someone when it's available, because it's not available right now. When it's available, if someone gets sick and it's recognized within the first 3 days that that you get this medication because it reduces your chance of hospitalization. One group who got it didn't had 3 hospitalizations out of 389. The second group had 27 with 7 deaths. So that if you get the placebo, right, you didn't do as well. So if you get the infection, ask your physician, who's treating you, to see if they have access to these medications. Right now they don't, but we hope in the near future they will.
All right, Dr.